Hi everybody, Dr. Joseph Cipriano out here in Palmetto Physical Medicine in Greenville, South Carolina. Today our patient here, she's been experiencing neck tightness, shoulder tightness, but I know you were telling me originally the low back was your main complaint, but today it's a little bit more, neck and shoulders, correct?
Yes.
Okay. And then, so I know you're at the office here, you do a lot of the medical billing, literally making sure that I bill out procedures correctly, which I get yelled at quite a bit. But she keeps me in check with that. She, makes sure everything does get billed out and, that things are collected. So her role here at this office is, substantial, which is, a major thing. But, as doing medical billing and procedures like that, you're on your feet, you're at a desk, you're all over. Yeah, I know that you do get a lot of tension in that neck and shoulder, so that's what we're going to focus on today. And we actually have, as you can tell, we've got two guests in the office, as they are going to say hi as well. So, let's go ahead and get started. What I'm going to have you do, I'm going to have you remove your glasses for me. Okay, and I'm going to have you start laying face down. Okay, so I'm just going to put this microphone right up here for a second. Okay, so main thing as of today, I know her chief complaint is going to be, in this upper back, in the neck, going into the shoulders. So this is going to be one of the main areas. Now what I'm going to do is I like to palpate. What palpating is, I'm feeling symmetry on either side of the spine. I'm feeling for tight muscles. I'm feeling for literally the symmetry. I want the right side of the body to match her left side of the body. So as I'm going through and pushing, I'm finding some tight muscles, some tender areas through here, and then I can make my way down into the spine. Even some tightness throughout the mid-back. Now when we make our way to the low back, I'm not finding as much tightness, which is a good thing. Is there any pain over the hips here?
A little bit.
A little bit of pain on the hips?
Mm-hmm.
Okay. And then, so I'm going to come down to the legs. I want to check the leg length here. So if you want to come in and take a look at this. So as you can tell, her right foot is quite a bit shorter than her left. Also, a thing that I look at, so if you were to take a glance and look up her body right here, you can tell that her hips are rotated off to this side like that. So little things is what I look for. I look for all the symmetry in the body here. So these imbalances, are what can be causing issues today. I'll have you pause. Okay. So what I'm going to do, I'm going to start the adjustment right up here in the upper thoracic, the lower cervical area here. Granted that this is where she is holding a lot of her tension at, which is normal. The trapezius muscle, that extends all the way from in the neck, goes down into the thoracic spine, and also comes across the shoulders like that. So as we come in first, I'm going to have her laterally flex her head. And as you can tell, you got a lot of movement with that right there. We're going to do that. Same thing on the other side. The only thing here is we're going to drop down one more level. We're going to be on T3 here instead of T2. There we go. So that alone, I already know you felt how much that just completely released and opened up right through there. Now I'm going to come in through the thoracic spine. We're going to do adjustment, which is a prone adjustment. All prone means is face down, where supine means face up. So we're going to start with the prone thoracic adjustment. I'm going to have you take a deep breath in and exhale all the way out. Good. One more time, deep breath in and exhale all the way out. Good. There we go. Okay. So now we got that lower cervical, upper thoracic. We have that adjusted. We finished through the mid-back with the thoracic adjustment. Now we're going to go through and we're going to look at the low back. Obviously, as you guys remembered, just from the foot lengths originally, she was quite a bit off. So if you want to come in here now and take a look, so just with doing the adjustments up top, it helped a little bit. As you can tell, this right leg is still very much short. So that is telling us a lot of our issues are coming right from here. So I first want to check your sacrum to make sure to see if it's more of a sacral issue or a lumbar spine issue. So I'm going to put pressure right here on your sacrum. I want you to lift your leg up from here as high as you can for me, okay? So raise this leg up as high as you can. Any pain, tenderness, tightness with that?
Yep.
Okay. So relax that side. Now I want you to raise this side up for me as high as you can. All right, do you notice that leg going up a lot higher than the other?
Yes.
Okay. So what I'm going to have you do, I want you to cross your bad leg, this one, over your good leg for me. Good, just like that. And we are going to do some drops on the table here.
Whoa.
So the table comes up. What I'm going to be doing, so that her sacrum, what's going on is her sacrum is rotated more towards the left side. So it's restricting her right leg from coming up. So what I'm going to do is I'm going to torque her sacrum back over to the right so both sides can go up just as high.
Oh my.
Good. So I want you to uncross your legs. I want you to bend this knee for me. Okay. Okay. So now I want to recheck the sacrum, see if there's been any change. So I want you to now raise that right leg up as high as you can for me. Do you notice a difference?
A little bit, yeah.
Okay. Now I want you to raise the left leg up. Good. All right, so as you can see, her right leg is still going up, not as high, but it has gone up a little bit more. So the next thing what I want to do is I want to also check right through here. So I'm going to do a contact down below. Good. All right. What we're going to do from here, so now I want to do more of a side posture adjustment. So I want you to lay on your side and face me. Okay. So I'm going to have you bend that top leg. So now the reason that I'm doing the side posture adjustment is she was still not able to raise that right leg up as high. She was still having some pain, on that low back. So these are areas where, we cleared out the sacrum. We adjusted that. Now we're going to work on that lumbar spine. Good. There we go. Good. And I'm going to have you turn to the other side for me. There we go. Perfect. I'm going to have you lay flat on your back. Good. I'm going to bring this headpiece down. There we go. Okay. So with this from here, what I'm doing is I'm moving her neck. I'm doing lateral bending side to side. I'm just feeling how the vertebrae are sliding and gliding from one to another. So I start all the way up, as C2, C3, and I start bringing it down, and I'm just feeling how the spine is gliding. And I want to check that on either side to see if there are any restrictions, any fixations, anything like that. From here, I like to do some rotating. Also, you want to see how the vertebrae, how they sit on each other. So the spine, the spine can laterally bend, the spine can flex and extend, and then the spine can rotate. So these are the three movements, and then obviously they can do them in conjunction with each other, where you can flex and rotate, just different things like that. So these are areas where, I like to put the spine into different movements to see how, it's gliding from one vertebra to the next. And as you can tell, she's got a lot of range of motion, a lot of flexibility in the neck here. And right there, we're just getting a little bit of movement on one side. And we go through and feel through the neck. Because this was her chief complaint. The chief complaint was the neck stiffness, tightness, and then going into the shoulders and traps as well. Good. So what I want to do is I want to have you slide on down. So I'm going to have you kind of come up. I'm going to have you slide down. Good. Okay. Okay, so I want to finish out with the neck first. What we're going to do, we're going to do the Y strap adjustment on the neck. From there, I just want to check the hips at the end, and then if you have any issues in wrists, hands, elbows, anything like that. But what we're going to do is the Y strap adjustment. Now this is going to be her first time ever getting this done, and any patient that gets this done for the first time, I don't use the full amount of force, as I would normally, just because one, I need to learn and kind of feel her body out. I need a little bit of feedback. I don't want you to be uncomfortable, and a lot of times, it's a new move. It's very powerful. It's decompressing the spine all the way from the cervical, going all the way down to the lumbar spine. So these are things that, with a lot of movement, I just like to make sure and be conscious and aware of, every patient. So how we're going to do this goes around the top right here, and if you can pull your hair through for me. Thank you. And I'm going to have you lean back. You can keep your legs off the table, but come on back. Good. And then from here, we're going to distract down. Well, let me first make sure. Okay, so she has no earrings, which is good. And then I'm going to distract out. And with the light thrust. Well, how was that?
It was good.
Have you ever felt anything like that before?
No.
Okay.
It's different.
Quite a bit of movement. You felt literally how that just pulled apart.
Yes.
And what that's doing is every vertebra that sit on top of each other, it opens up that opening where the nerves exit out from, and it removes pressure off those nerves. So when it removes pressure, it allows the body to heal and function, as it should. So from here, after I did that, that was the main thing. So that's really going to help clear out a lot of those neck and that upper back issues. I just want to check your feet and ankles just one last time at the end.
Okay.
So I'm going to have you just slide up a little bit more. Yep. Okay. So I'm going to come back down here. Actually, we're going to move the mic. Good. And I'm going to come back down here. And what we're going to do, we are going to just make sure the leg lengths are balanced. So when I come in through here, actually pretty darn straight on. If you want to look from the top, hands off, as you can tell, a lot more balanced, almost exactly compared to what they were originally. So these are things that, that we want to make sure and check. Have there been any issues with knees, ankles? Right ankle? Mm-hmm. Okay. So with the right ankle, what I'm going to do, so first, just relax your ankle. I'm just going to put it through some range of motion. Is there any pain with any of this? No. And then when you do feel issues with the ankle, what is it in general? Like, what do you know?
It pops a lot and it hurts.
Where at? Okay, so more on this side.
Yeah.
Okay. So what we're going to do here, so we're going to check. We're going to start off doing the adjustment, on her feet and ankle. So we'll start actually with the leg pull. Just opens everything up, from the ankle, the knee, going into the hip. And we'll start right through here. Good. Can I take this shoe off? Okay. So now with the ankle and feet, we want to get some movement in between all the bones here, all these metatarsals. So what I'm doing is I'm doing just a shearing type movement, just trying to open everything up and relax it. And she's feeling, some distraction movement in here, and that's the main thing of what I'm going for. And then when we bring the ankle up. Good, good. Okay, so you get a little bit of movement in that ankle. Also, what I like to do, especially when being out of the office, I use what's called a vibrocursor, and it's more of a soft tissue technique. So I'm working on the areas right through here. So majority of her pain was on the outside of her foot. So there's a lot of ligaments and tendons through here. These areas can cause a lot of, first, they can easily, be rolled, if you roll your ankle. And then also, if they're not properly healed, it can also cause a lot of pain as well. Was there any pain with me using this on your ankle just now?
Not pain, but discomfort. Like I need to pop my ankle.
Okay, so she does feel that little bit of discomfort in the area. Now, when you feel it, is it more down here at the bottom going around, or is it more up through here? More on the bottom?
Well, and when you right, if you get back up to the top, it was like right there.
Right here? Okay. Okay, so these are some of the areas on that outside part of the leg here that we'll be working on. So throughout multiple videos, we'll definitely get a little bit more in depth with the ankle, with the leg, with the foot. Today, we're going through, we did the adjustment, we're using the vibrocursor, and we'll monitor how the ankle responds to care, and we'll adjust accordingly with that. So, I'll have you come back up. Perfect. So I'm Dr. Joseph Cipriano, and this is the adjustments that we do, especially with the neck and shoulder tightness, the low back issues, and then as you can tell, the foot as well. So, we'll definitely be seeing, more of her, and, we'll follow up, and you'll see exactly how she's responding with care, and we'll go from there. I'm Dr. Joseph Cipriano out here in Greenville. If anybody wants to schedule an appointment, I do leave all the contact info in the description, so feel free and contact me. Have a good one, everybody.